First total shoulder, we want to be mindful of our base plate position. We know superior tilt is bad. It does lead to failures. So we do have to correct this RS angle, and I'm not going to spend a lot of time because George did a great job describing this, but we do have to correct this inclination at the time of surgery. And ultimately, there's a couple different ways to do this. You can use bone graft, as George mentioned. You can use augments, or you can ream. I think most of us have gotten away from the idea of this just reaming the bone away and over-medializing the implant. So in this case, you can see in order to get full contact of our base plate, we probably would have to ream about 1 centimeter of bone, which is probably not ideal based on the principles of lateralization that George mentioned. So I think we're in agreement. We want to be lateral. On the glenoid side, at least to a certain degree, without over-lateralizing. So the question is how to do that effectively. Well, bone grafting, as George mentioned, is an option, and certainly bio-RSA is great with the humeral head, but there's other options too with distal clavicle or allografts or iliac crest grafts that have been described. And most of these techniques in general, you're putting the graft behind the back base plate in some sort of structural fashion in order to support that implant in order to gain stability. And the bio-RSA, as was popularized by Pascal, unfortunately couldn't be here today, has shown some good results. But let's look at the long-term results of this. George, showed us some 2-year data, which is great. But I would argue if you look at like tumor literature and anything else regarding long-term results of bone grafts, you don't see resorption or failure in the short term. It's more mid to long term. So when we're looking at this, good results. Clinically, these patients do very well. But I think the concern is in this. So when you look at this, it's called scapular notching. I'm not sure if it's 100% scapular notching or some graft resorption, but the rates are not insignificant, about 18% radiographic issues in this bio-RSA study.